what is a traumatic brain injury? And you could tackle this, and or the causes, symptoms, prevalent impact on person and society, however you want to tackle the question.
Yeah, that's a great question. So, whenever the head gets accelerated and kind of immediately stopped, what happens is that the components of the head, the brain, the skull, that stuff, the cerebral spinal fluid, decelerates at different speeds, right? And the brain, decelerates slower than the skull, right? And what that does essentially is it allows for the brain to impact the skull and effectively hit the skull, right? And that's what you see, whether it be football TBI or even a blast injury or whatever, that the brain moves in a different way than the skull moves, since the brain effectively hits part of the skull and causes injury to the brain, because obviously the brain is less hard and less dense than the skull. And so there are kind of standard ways in which that happens, and that's kind of the frame that this kind of falls under. So in the case of military TBI, a lot of it ends up being blast injuries and whatnot, where people get thrown back and their brain actually accelerates quite quicker than their skull, and their brain effectively smashes into a part of the skull and causes a dysfunction. And that can, produce a whole host of symptoms that for some people persist ongoing.
Any kind of injury can take a number of forms. If I think about injuring my knee, right? I could, tweak it a little bit and it like hurts for a little while and I cause minor damage, but it's, whatever. Or I could like have a minor strain, or I could fully tear my ACL. I could shatter my, part of the bone or something. There's like a wide range of potential injuries that can occur when I say fall on my knee. What's the sort of range for like the kind of what would qualify as a traumatic brain injury? Sort of like, you don't have to go into every single one, but sort of like at its least extreme, it might be like this. At its most extreme, what has happened to the brain would be diagnosed as this. Just give us a sense of the range.
Yeah, I mean, so there's mild, moderate, and severe traumatic brain injury. Severe traumatic brain injury is seen on structural MRI. It usually takes the form of, kind of a traumatic subarachnoid hemorrhage or a contusion of the brain. So basically, there's some, bruising, bleeding that happens alongside structural injury. You can have people get in car accidents and they can have the orbit fracture backwards and hit the orbitofrontal cortex and cause contusions and whatnot. And so that's all kind of within the range of possible kind of severe TBI, whereas mild, range of what we think about as a concussion, really, there's nothing on brain MRI, there's nothing on CT, standard MRI and structural MRI and CT, and so you're really just seeing a kind of functional impairment and a headache, nausea, vomiting, that sort of thing. And so there's a big range of what you can experience from like the severity. And then because the brain has different functions and the place in which the brain accelerates and hits has a different function, you can have a host of symptomatology that presents as a result of where in the head you were hit, or which direction the blast injury happened.